In this video, you'll get a quick overview of Vibrant's Viral Infections panel. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. Chronic viral infections can contribute to the development of various conditions, including autoimmune disease, cancers, and other complex disorders. For example, cytomegalovirus or CMV infections have been reported frequently to be associated with Guillain-Barré syndrome. Epstein-Barr virus infection can lead to central nervous system complications such as encephalitis, meningitis, and psychiatric abnormalities. Herpes simplex virus 1 antibodies have been correlated with increased risk of Alzheimer's disease. And human herpes virus 6 is frequently associated with neurological diseases, including multiple sclerosis, epilepsy, encephalitis, and febrile illness. Vibrant's Viral Infections Panel is a blood test that detects IgG and IgM antibodies to 6 viruses and 1 bacterium that are commonly associated with numerous health conditions. The Viral Infections Panel is a standalone test for infections. However, this panel is included with the Tick-Borne 2.0 and the NeuroZoomer Plus tests. The Viral Infections Panel is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice those wafers into tiny microchips. Then, arrange the microchips, 1 for each antigen, in a 4x4 or 10x10 grid atop 1 pillar on a 96 or 24 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and full report. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The viral infection sample report includes a cover page, introduction, summary, then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, reference ranges have been established using a cohort of 500 apparently healthy individuals, and also the part where it says, a classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range, and the classification of red denotes a result that is elevated with respect to the normal reference range. The summary shows the elevated and moderately elevated results along with interpretive comment. And the full report lists the levels of all markers, including multiple antigens for cytomegalovirus, multiple antigens for Epstein-Barr virus, herpes simplex virus 1 and 2, human herpes virus 6 and 7, and streptococcal A. Current and previous results populate side by side so you can compare the IgG and IgM titers over time. If you want to learn more about antigens that are outside of the reference range, scroll back to the summary and read the interpretive comment. So, which patients benefit most from this test? Well, conditions and symptoms which may benefit from testing infections include neurological disorders, behavioral issues, autoimmune diseases, immune dysfunction, inflammatory conditions, chronic pain, and chronic illness. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1: if you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2: if you're sitting on 2 TACs, removing one does not necessarily result in 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the viral infections panel, consider the gut zoomer to assess for infections in the gastrointestinal tract, including parasites, viruses, fungi, and bacteria. Also, the Candida plus IBS profile to assess for immune responses to Candida and fungal infections within the body. And also the Tick-Borne 1.0 to assess for Lyme and co-infections. Remember, Tick-Borne 2.0 already includes the viral infections panel. And finally, total immunoglobulins. Serology testing is based on normal, functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, Vibrant's viral infections panel uses highly specific and sensitive microarray methodology to measure IgM and IgG antibody levels to 6 viruses in 1 bacterium, helping identify if viral or bacterial infection is driving neurological, autoimmune, or inflammatory conditions in your patients. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.